All right. Well, first things first, why have you decided to run?
Um, well, Lorraine, I decided to run. I'm going to tell you a little bit about myself first before I tell you why
Yeah,
I
sure.
decided to run.
Yeah,
Okay. So, um, so I'm Sandra Van Scotter. I'm running for California's 20th congressional district.
yeah,
Before I moved to California in 2014, I worked in healthcare for a long time. I was a respiratory therapist for about 20 years, and
yeah,
I learned pretty quickly just how much control the insurance companies had over the care we give and the
yeah,
care we receive as patients. I remember walking into work one day saying, "Hey, you can't deliver this therapy to this group of patients who receive this insurance because their insurance isn't paying for it anymore." Um, and I was really surprised to see that insurance had that much control over
yeah,
how we receive and give care as healthcare workers and as patients. When I moved to California in 2014, I started working in an outpatient setting, and I got to see more of how insurance behaves and controls the care that we receive as
yeah,
patients. I got deep into the what's called the pre-authorization process, where I had to ask insurance permission to do a test before I could do a test on a patient. And a lot of times it would be pretty arbitrary about, how they decided to grant permission
yeah,
to give care, to authorize the care or the testing. Um, Sometimes they wanted other information first, like before you did this test, we want to see the patient fail these other tests. So they would actually spend more money to then potentially deny the test that the doctor really wanted. It was it
yeah,
was it was interesting. So so from there, after COVID, um, I started working with intellectually and developmentally disabled adults, helping them maintain their independence. And when the Working Families Tax Relief Act, also known as the Big Beautiful Bill, when
yeah,
that was signed into law last year, the people that I already serve, they were immediately concerned and frightened, actually,
yeah,
concerned that they were going to lose their benefits right away. And in my work with them over the couple of years before that bill was passed, um, we had gotten them set up with, navigating and how to um, roll with changes that might be coming in their future. So we set them
yeah,
up with ABLE accounts. ABLE is achieving a better living experience. And that type of account is available nationwide. And it allows people who are on Social Security insurance or Social Security disability insurance um, receiving Medi-Cal. Um, Benefits that don't allow people to have money saved over
yeah,
$2,000. It allows them to save more money. So we had already gotten them set up with all this stuff, and then that bill got passed, and they were worried. And I'm like, no, we're ready, we're ready. And I thought, if I can help the group of people that I'm already serving get ready for this, what's coming, I can help a lot of people. And
yeah,
that is why I decided to run initially. But then as I started going throughout the congressional district and meeting people and driving. I've put well over 30,000 miles on my car at this point, as of this recording, driving throughout our congressional district. Um, I saw that people were excited to see that somebody was running for this office because this geography has been, represented by people who aren't representing the people for a very long time.
yeah,
And, they were hopeful for change. And so I decided I'm going to run to win. Not only am I going to run to help people, which we're definitely doing, but I've, also decided, yeah, we can win, and I'm going to run to win. So that's where I'm at.
great. what are your main priorities, the main issues you want to prioritize?
So immediately when I get into office, the main issues I want to prioritize is actual representation. Right now, I get a lot of feedback from people trying to contact our current representative's office. There's either no answer, or somebody will pick up the phone and basically say, "Sorry, can't help you." One person reports that they were actually told to call somebody who cares. Um, there's an expectation of our representatives to help us um, navigate federal programs like veterans disability benefits
Yeah,
and social security disability. Um, all of the other representatives that I've looked at their .gov websites have a link to start that process, because the starting of the process is basically signing over permission to have access to their stuff. So
yeah,
it's an information release. Mr. Fong doesn't have a link like that on his .gov website. So getting that process started for his current constituents is near impossible. And so it's so that became my first priority, is making sure that people can access my office, access me, and start to receive the help that they need navigating these
yeah,
services if they run into a roadblock that they can't overcome on their own. Um, the next thing I'm prioritizing, because I understand where this election is at, it's in the middle of this presidential term. So we have 2 more
yeah,
years of this administration. And so the next thing I'm prioritizing is collaborating with um, Sacramento and the state offices of the services that the federal government collaborates with, um, administering services and benefits to. And I've already reached out to several senators to start building those coalitions and collaboration and cooperation between the federal side of benefits and the state side of benefits, to make sure I can direct people to the most accurate starting point if it's
yeah,
state services that they're having a difficult time accessing. So the congressional district that I'm running in covers 4 counties or parts of 4 counties. So there's 4 different ways to access a similar benefit. So, starting to build those relationships with those counties to make sure that, I'm not leading people on a wild goose chase if they come to me first for how do I access a benefit or a service.
yeah,
So those are my main priorities. Um, on the federal side, once I get into the House of Representatives, into Congress, is to build those coalitions on the inside. Make sure I understand what tools that we already have available to us that we can continue to implement to serve the people who brought us into office. Um, you know, really firm up relationships with allies that have similar goals and
yeah,
agendas to serve the people in their districts. Um, getting my footing really solid in the House of Representatives, and making sure people understand where I stand. I am currently running um, not accepting any organized money. So I'm not accepting any corporate PAC money, no PAC money at all, nothing from unions. I am truly supported financially by individuals, and individuals making donations to my campaign. And so I believe that makes me more approachable.
yeah,
And I also believe it puts me in a space of not having to answer to people who gave me money, because the
yeah,
people who gave me money are the people. So, I feel like that puts me in a more powerful spot, actually, to really speak up for the people in my congressional district, and by extension the United States of America, because I don't have what people are calling a NASCAR jacket with all of my sponsors on it. I don't have
yeah,
that. So that's been pretty important to me. And the more I go through this campaign process, the more important it is to me to to maintain that, I haven't promised to uphold anybody else's agenda except for the people's agenda. So,
That's
and
great.
then the next priority is to stop the damage and to stop the ongoing implementation of that the HR1, the Working Families Tax Relief Act. The We're already seeing it implemented in the county I live in Kern County. There's been lots of layoffs from several different hospital systems. Um,
Yeah,
um, the work requirement for SNAP, what we call it SNAP or food stamps, and what we call in California CalFresh, um, those came into effect for 3 of the 4 counties I'm running to represent in June. So coming in September, if people don't meet the requirement, a lot of people are going to lose their food stamps. Um,
yeah,
we already have a significantly higher unemployment rate, but we didn't qualify for the exemption to the work requirement for SNAP because our unemployment rate isn't high enough in 3 of the 4 counties. Um, so I think come September, October, right as ballots are getting ready to drop or dropping, um, people who didn't think that they were going to feel the effects of this implementation of these drastic cuts are going to
yeah,
start feeling that. And so my goal once I'm in Washington is to put a stop to further implementation of it. I believe realistically, um, having a majority in the House, maybe having a majority in the Senate, but not enough of a majority to have like 60% of the vote kind of thing,
yeah,
and still the same administration. Realistically, I think putting a stop to things is what we can realistically ask for. I feel like we are in an environment where we have to be careful, you know, to be accurate in what we can do
yeah,
and really giving people a good idea of this is what we're going to be able to do. With a majority in the House, there's going to be ability to do investigations and start to hold people accountable for how we got here. And on the state side, that's definitely something I'm going to be asking for. I was reading social media in response to one of my incumbent social media posts. One of the people in response talking about water, she says 62 years ago we were trying to fix our water crisis. What is so complicated about this that we can't fix our water crisis? So there needs to be an accounting and an accountability of how we got here in California
yeah.
also, and that's something I'm looking um, to also pursue um, as a priority, getting into the House of Representatives.
Great. Well, tell me a little bit more about accountability because it's something that you really focus on. And what are your, the policies that you would like to see implemented in terms of making sure that our representatives are accountable to the constituents?
So yeah, it is really important to me. This is my first time running for office. And
Yeah,
so there's things that I thought I believed that I'm learning pretty quickly that are not accurate. And things are a little different. So the learning curve for running for office has been pretty perpendicular. It's straight uphill from
yeah,
from where I'm standing. And so in my research, one of the things that I continuously look for is who benefits from this bill being this way. And it always comes back to not necessarily the parties, but the lobbyists.
yeah,
Who benefits from this? And so I feel like there's not enough transparency on the state level or the federal level about how involved lobbyists are in our legislative processes and how bills get made, introduced, passed, why they don't pass, why they pass with these amendments. If you on the California side, you can see how bills are changed as they go along before they're
yeah,
passed. And I like that, but it doesn't in in the official documentation, it doesn't explain why it got changed. It just shows a change. And so I think people have the right to know how involved lobbyists are in our lawmaking processes on the state and federal level. And I think the lobbyists themselves need to be exposed with each bill.
Yeah.
This is why they lobbied this way. This is how they benefit from it. And I think when people understand just how intertwined um, lobbyists are in our lawmaking process, you know, it, hopefully it'll make people mad. I really hope it'll make people mad, and that people will start to, demand that it's the lawmakers making the laws,
Yeah.
not the lobbyists. And I'm being told at the federal level that there's, especially lobbyists who have, been representatives first, they basically write the legislation and it's presented. And I don't think that's right. I think if, our lawmakers aren't putting the time and energy and effort into this, aren't able to explain to themselves and to their constituents why and how a law was written this way, um, their name shouldn't be on it. If somebody else is truly writing it, and especially if it's a lobbyist writing um,
Yeah.
potential legislation. So that's where the accountability piece comes from. I know in the region that I'm looking to represent in the 20th congressional district, there's a few people with a lot of money that are holding all the strings and cards. And over and over again, it's those few people with specific names that everything that doesn't support or take care of the people goes back to. And I had quite a few constituents say, I want to hear this person say they knew what the destruction was they were doing,
Yeah.
and so, clearly I can't make people say that, but people are so fed up with
Yeah.
um, how money has bought everything, and people are just an accidental existence in their process of making money.
Yeah. I'm seeing that by
Mm-hmm.
interviewing all the candidates. I'm seeing that. Well, all right. Because of your background, I thought it would be necessary to dive into healthcare and what are your plans on that issue?
So my plans on that issue, there's you know a couple of good bills in the House and the Senate, um, on the federal level for Medicare for all. The
Yeah.
Senate, excuse me, the Senate bill introduced by Bernie Sanders, I believe, is the more reasonable transition piece to go into Medicare for all. Um, having California is pursuing their own single payer healthcare system called CalCare. Um, on paper, it looks good. The implementation of it and really the benefit of it, I think needs to be explored more. So the implementation of
Yeah.
it requires, just to have a statewide single payer healthcare system, still requires that the federal government give us what's called Medicaid waivers to allow us to spend the money differently, the Medicaid funds differently than what they had been originally intended. So they're waiving the requirement or waiving the rules so that that funding can be used differently. Um, to get a waiver to do that during this current administration, they've already demonstrated that they're not going to be
Yeah.
favorable to changing a waiver to allow for a single payer healthcare system in a blue state. Um, so so there's that part of it. And then the other part of it is the portability part. Right now, if you're on Medicaid or Medi-Cal in California, and I know a few of the other states have, state specific names for their Medicaid programs. If you are receiving your insurance through one of those Medicaid programs, you can't go from state to state. So we'd have a single payer system in California, but we wouldn't be able to cross over into Nevada. And if we got into an accident or if we got sick, coverage at a hospital in Nevada with I'm sorry, Medi-Cal just won't happen. So, there's still an element of risk for the person receiving the
Yeah.
benefit, and it kind of holds them captive in their own state. Um, and I understand this personally. Um, Being on Medi-Cal, when I go to visit my daughter and my grandkids in Illinois, I'm, essentially uninsured. So I'm super careful. Hey,
You
I
have
can't
to
do
be.
anything while I'm here. So can't try new foods because but anyhow, um, so a nationwide healthcare system, a nationwide single payer system like what our current Medicare is for people over 65 and people who have been receiving disability benefits for more than 2 years. Um, that if they're on traditional Medicare with a supplement, um, they can go pretty much anywhere in the country because even the Medicare Advantage plans are state specific. So
Yeah.
even if they have a national name like Humana or Blue Cross or whatever, um, if they travel from state to state, they can't use their Medicare Advantage plan in a state that's not their home state. So we have that going on. The other thing that I would really like to lay the groundwork to be able to implement with our new administration that comes in 2029 is a transition into Medicare for all. Because the Bernie Sanders bill has a transition in place, um, but it
Yeah.
relies pretty heavily on um, collaboration and cooperation with the employers and with our current for-profit healthcare system to cooperate in the transition process. I think an addendum to that is a buy-in to Medicare. And California has a similar system with that for a very specific group of people, but I would like to see that be offered nationwide to people like a Medicare buy-in as a transition into Medicare for all, because it'll take a
Yeah.
full 4 years to transition everyone into Medicare for all. And I think it'll also give our insurance industry, it's truly an industry right now, and our employer base an idea of how a transition into Medicare for all is going to look. And I think from the employer point of view, once we get past the inflammatory words of socialism and all that stuff, they're
Yeah.
going to see that their cost of providing benefits like healthcare are going to be dramatically reduced. And I really wish that more people would just look at those numbers and stop with the label of socialism because there's nothing
Yeah.
socialism about this. Even back when the ACA was initially signed by President Obama, the first thing I thought was, well, that's not going to work because the insurance system is still for profit. And and
Yeah.
and we've seen that the only reason why it felt like it was working was because there was the subsidies to absorb the cost from us, the end user. But once those subsidies went away, we saw really how catastrophic the cost of the ACA program really was.
Yeah.
And as of February of this year, there are 3 million, at least 3 million less people on the ACA programs than there were of February of last year. So nationwide. So we're already seeing that, if people got to choose between paying rent, feeding their kids, and having health insurance, they're going to pay rent and feed their kids every time.
Yeah. All right, you also mentioned water management, water quality, and of course, there's this debate on AI data centers and how they're making an impact on the environment. What are your stances on those issues?
So Starting with the water first. The water situation in California is multifaceted and complicated and goes back all the way to the early 1900s. And to the credit of the state of California, navigating around systems that have been in place for over 100 years, um,
Yeah.
they've they've tried to find equitable solutions. But then as we got into the early 1990s, where there was basically the Monterey Agreement and then the Monterey Amendment, where there was agreements made, contractual agreements made about water and who owns the water and who gets to sell and buy water. It's really a convoluted thing that kind of put some handcuffs on how water rights and regulations could be legislated. And from there, we've had this cascade of trying to do our best and not really being able to do as much as we want to do because of this Monterey Agreement.
Yeah.
It's been legislated for, not legislated, fought in court for a long, long time. And finally, I guess in the early 2000s ish, that all the ability to fight it pretty much was ended at the court level. Um, so there's two very distinct sides of our water crisis. There's the human consumption part of our
Yeah.
water crisis. Um, Lots and lots of our little towns have their little water districts that don't have the resources or the funding to be able
Yeah.
to keep their water safe. They're at the mercy of, however funds are distributed. And so we have lots of towns having their water trucked in. We have lots of towns that are on the edge of agricultural industry that all of the runoff goes into the drinking water supply, and so there's poison from the fields
Yeah.
in the drinking water. So um lobbyists in big business have been very involved in how water gets regulated in California. And even in an interview that I participated in with our incumbent, Mr. Fong, his answer about the the State Groundwater Management Act is, or the Sustainable Groundwater Management Act was, it is what it is. Um, that, he, kind of
Yeah.
put his, shrug kind of thing. It is what it is. And the rules with that have really made it difficult for groundwater authorities and water districts to be able to meet and maintain the rules with it's called SIGMA, the Sustainable Groundwater
Yeah.
Management Act. Um, so it's kind of in a gridlock with all of that. And then we add the data centers. I live in a town, I live in Ridgecrest, California, which is next to Inyukern, where there's a data center proposed to be developed.
Yeah.
And it's not on a military base, it is immediately adjacent to a military base, China Lake. And it is not being developed for military use. It's being developed for commercial use. Um,
Yeah.
our groundwater basin is significantly overdrafted already. And the presentation of the developer that wants to put this data center next to the base in an area that has virtually no water. I mean, um, yeah, the water we're using, it's like, make sure you turn the faucet off, while you're brushing your teeth. A lot of
Yeah.
us only wash
Yeah.
our towels once a week. We're very water conservative in our town. And the developer very much underestimated or underreported how much water they thought they were going to need to use. Um, it's If it was just one data center, that would be one thing. but there's the potential of development of up to 20 data centers in the congressional district
Yeah.
over the next several years. And, even though that water basin over there, might be not quite attached to this water basin over here, you still have a whole geography that is already overdrafted. And I can't support the development of data centers at the risk of whole, hundreds of thousands, if not millions of people losing access to water.
Yeah.
Um, so the interesting note about the data centers themselves and this all of a sudden boom proliferation of development of data centers, last year, toward the end of July, there was an executive order from the president that pretty much removed restrictions to allow for fast tracking of development of data centers of specific sizes. And in addition to this executive order, there were three, what do they call them? Resolutions and a couple of different laws proposed to also kind of like make that executive order permanent, to
Yeah.
support the executive order. And then on the California side, there was legislation that was overwhelmingly passed the Assembly and the Senate that was vetoed by Governor Newsom, to require that the data center developers be accurate in their estimate of how much water they would use while the data center
Yeah.
is running, and then verify that they didn't go over that amount each time they renewed their permits. That was vetoed by the governor in October of last year, and that those series of events pretty much opened the floodgates for data center development. Um, some of those data centers are being developed on military land, on military bases at Edwards and Naval Air Station Lemoore. And so that's going to be a harder fight for the communities to put a
Yeah.
stop to them. But for the ones that are on public land, the public just really needs to be speaking up and asking their city councils, their boards of supervisors, their at every level of every office or agency that touches the approval or denial of the development of a data center. The people just need to be speaking up and being, persistent and insistent
Yeah.
that, why do we need 20? So so
Yeah.
it's 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 been pretty interesting.
All right. Well, we have only 5 minutes more. So my last question would be about your stances on civil liberties and, of course, ICE.
My stances on civil liberties, I am very much an advocate of the Equal Rights Amendment being made an amendment. Um, I don't know what political or legislative or whatever snafu happened that kept it from being made an amendment, but here we are in this space where it could have been, and now it can't because a couple of states backed out of it. Um, Very much the Equal Rights Act, um, as far as women's rights, um, human rights,
Yeah.
LGBTQ rights. Um, Once we're stepping on any one group's rights, we are stepping on everybody's rights. And I don't think that um, laws should be made specific to, um, everybody has rights except for them. Um, or,
Yeah.
for example, gender affirming care for minors. So there's this, if you provide gender affirming care for minors, people assume going to mean medications and surgery, which neither surgery never happens really, specifically for transgender care for
Yeah.
minors. Um, but medications being withheld from gender affirming care also holds those medications from minors who might actually need it for other medical needs. And
Yeah.
so we're we're holding other people's care hostage because the the rhetoric and propaganda about gender affirming care for minors.
Yeah.
So we have whole hospital systems that have stopped offering gender affirming care for minors because they didn't and couldn't afford to lose that federal Medicaid funding.
Yeah.
So which is really what it came down to. Um, so and then regarding ICE, um, let me go back to civil liberties for one moment. Um, in office, when I am in office and I'm looking at these types of things, um, my question is always going to be, what does the Constitution say? And if we
Yeah.
veer this way or that way, why would we veer this way or that way? And if we're ever veering toward restricting rights, that is not a bill I'm going to support.
All right.
So, um, so yeah, it's the rhetoric and the things that people think they know about, for example, LGBTQ rights, LGBTQ community plus community. Um, their community is also members of virtually every other community whose rights might be
Yeah.
being infringed on. So, and that's where I came from with, when we're stepping on one people's rights, we're stepping on everybody's rights. Um, but at the same time, the rhetoric and what people think they know about LGBTQ community is that it's about, how they use their genitalia, which is not anything about, you know,
Yeah.
being part of the LGBTQ community. You know, gender identity and sexual preference are two completely different things. And
Yeah.
so I just, you know, really want to make sure that people understand that that is where I stand. I'm a true ally of the LGBTQ community. Um, I don't ask people what their, what communities do you, identify with. Um, because I'm running to represent them regardless. So so
Yeah.
there I kind of wanted to finish on that. And then with immigration, I am old enough to remember when President Reagan's administration had the amnesty program. And just short of 2 million people took advantage of the amnesty program in the mid 1980s. Um, for the people who are here in the United States, supporting our safety net services systems by paying taxes into our system, even though they'll never benefit from it, they had the same fears back then as we hear people have now. They're afraid of being rounded up. I knew people, I was a teenager then, but I knew people who would carry all of their earthly possessions in their car in case they needed to get away quickly because they thought they were in a space where they were going to get caught.
Yeah.
So, this kind of behavior toward people who may not have the appropriate documentation to be here legally, um, it's always been there. What we've done now since the Patriot Act, and especially since President Trump's first term and our current term, is an abuse of the offices that have been created with the